So good afternoon, evening, morning, depending on where you're joining from. It's always great to have you all here with us. And I'll just like to invite you as you're joining, just type in your city and your country so that we'll know exactly where you're joining us from. And this evening, I am here with Francois Gaz, as always, and Shalini Kare from the Scholar team. Just a gentle reminder, if you are going to type your city and your country, make sure that you are using all panelists and attendees so that everyone that is in the room will be able to read your message. And greetings to you, Nuhu Sani. I see that you, that's joining us from Nigeria. You sent your message only to the panelists. Please, when you're sending, make sure that you, on your chat, it is written all panelists and attendees. It's the same thing with Denisa Janta that's joining us from Bucharest, Romania. Great to have you with us. Make sure you're typing to all panelists and attendees. Thank you, Denisa, for correcting that. All right, our session is a real lightning session. It's just 30 minutes that we have, so I'm not going to take so much of your time because it's all about you sharing experience. It's about you talking, and we'll be there listening. So if you have a question, you can use, click on the Q&A icon that's on your screen to ask your question or to respond and comment to the questions that are being asked. So for this evening, what are we looking at? We are going to get some few updates from the IGES engine. You'll be sharing your experience just like yesterday. And I just want to invite you, if you're in the room and you want us to take a look at your experiences, and just begin to prepare yourself. When the time will come, I'll ask you to raise your hand, and the first person to raise his or her hand will be that person that will be invited to share their story today. All right, so, and then once you have shared your experience, we'll be getting feedback from Francois Gaz and the rest of the peers in the room. So before kicking off with our agenda, I'll just like to invite Shalini and then Francois to say a word of welcome to those that are in the room. Shalini, over to you.
Hi, Charlotte. Thank you so very much. Hi, Francois, and welcome everybody. It's a great pleasure to be here and to listen to all your ideas. I won't take much time. I hope you enjoy the session, and I'm sure we guys will really learn and enjoy the session. Thank you, Charlotte. Over to you.
Okay, thank you, Shalini. Francois?
This Francois is sharing the same views as Shalini, and let's move on it. I'm looking forward to hear the idea and all the details of this idea and how it was implemented, how it was raised, and other elements that we can share globally and benefit from it. Thank you very much.
Thank you to Francois. And I just want to say a warm welcome to James Atta Onoja that's joining us. I don't know where he's joining us from. There's Umaru Bature that's joining from Niger, okay. And there is Hassan Yusuf Mohammed that's joining from Somalia. You're all welcome. And today is our second daily lightning session in which we share actions and ideas, concrete ideas on how we could tackle immunization challenges that we are facing in the context of COVID-19. And talking about ideas, we have our ideas engine. I'm sure all of you 2 days ago received an email address calling upon you to join the ideas engine. So far, 1,030 scholars have registered or are still trying to register into the ideas engine. You have at least been able to log on to sign up in the engine, but we are hoping you'll be able to, all of you will be able to follow through and actually confirm your registration. 250 ideas in 2 days have already been submitted in the ideas engine, and more than 70 of them have already been translated either into English or into French. So good job, but we would like, for all those who have been able to submit an idea, we say kudos to you, and we hope that the others will join the train very soon. So right now, we are going to, before we invite the peer that is going to, the scholar that is going to share his experience this evening, I just want you to remind you of one or two things. Before sharing your idea, you may want to think about this. Imagine you're sitting with somebody you don't know, and that person asks if you can help them in their work in restoring routine immunization or how they can plan their supplementary immunization activities during COVID-19. And for you to be able to help them, you need to explain in some detail, you know, where you work, and what you do. How are you doing what you're doing, especially if you're getting results? How are you managing to get the results that you are obtaining? So we have prepared a series of questions that will help you so that you can give more details of your ideas. So I'll just want to put up the questions you want to consider while sharing your ideas. I'll just take a couple of seconds. And while we are going through these questions together, I would like to invite you, if you want to share your idea, please raise your hand. If you want us to listen to your experience today, please raise your hand, and you'll be using these questions as your guide. You'll be using these questions to direct you as you share your ideas with us. So I'm waiting to see the first raised hand. So is your idea based on your experience? This means that it is something that you have either done or are doing, or you have observed being done, and you want to contextualize it. Which country is it taking place in? You want that you should describe the specific challenge and the context in which that challenge is taking place, because the idea is to resolve a particular challenge that you're facing. So we want you to concretely share that challenge. And then what data do you have that document the challenge? It could be a drop in immunization coverage, could be a drop in demand of immunization services. Do you have data to back up that? And how did you get that data? And then what are the concrete action steps you are taken or you have already taken? So you have to tell us about the who, the what, the when, and the how. That's very important. And then at what level of the health system is that being implemented? How are you measuring progress and the results? How will you know if things have changed? And do you have any concrete results already registered so far? If you were to have results, how will you measure them? And then what 3 things have you learned from this practice that you would like to share with other participants? So lessons learned are very important. So I've gone through the questions, and now is the time for you to raise your hand. I'm waiting for the first person that will raise his or her hands. Francois, I think the scholars are thinking through, trying to put order the ideas, their thoughts in their minds before raising their hands to present. So while they're doing so, all right, I'm already seeing a raised hand. It is Eunice Yowati. Okay, so please, Eunice Yowati, forgive me if I can't pronounce your name right, but while I'm allowing you to unmute yourself, so when you begin to talk, I would like you to really present yourself, pronounce your name better so I can learn, and then you have the floor. Over to you.
Yes, thank you. Just call me Eunice. I already share the idea about the immunization, because in my area we do other strategy. We built like the name is the post of COVID-19. So the post will be in the village. I already share the experience, but for the data,
Eunice, please excuse me, before you go ahead trying to answer the questions, please can you just tell us where you are calling in from?
Sorry. Yes, I'm from Indonesia. For a moment, I work in the 2 districts in Carita and Labuan in Pandeglang, Banten, Indonesia. So I'm a community health promoter in that area. So our strategy is build the post information of COVID, because to make awareness in the community, because they think in the community the COVID is never come to the village. And then yeah, the COVID is some theory of the conspiration too. So we built that so everybody may be ashamed to ask. They can come to the volunteer house or the post or ask the cadre. So the cadre we give a train. The train is very short time, only 30 minutes or 1 hour, of course, with the protocol of the health for the COVID. And we share experience, we give the train so they can answer if the community or the people coming to their post, so they can answer. And the first month, 3,500 people come to the post. The post in Charita, we have 60 posts, and in Labuan we have 90 posts. So overall 150 posts. So they come and we create some form to the cadre on volunteers so they can fill the form, just a simple form like where they do the session, how many people, male or female, and the topic, what the kind of the topic. Only that for a moment, but still running. Is already 3 months we do like this, and the data will be used to the team COVID in the district and sub-district, and of course to the health center we share, so they know what the people needed in the community, what kind of the IEC needed in the community, so what information. So we know the people now more and more have awareness now. Maybe around, yeah, to change the behavior is not easy, need the time, of course, and engagement with the local people, with the public figure, and local government too. We still do it. So it's on progress, but more better, because now they not only ask the COVID, they ask, okay, how about the immunization? Where we can get it, the immunization? How about the posyandu? Posyandu is the post health center in the village. Usually every month they will open and do the services with the midwife village. They will asking because sometimes that activity is the close because depend of the zone, red zone or the green zone. If the red zone, of course, the activity will be closed for a moment. After the good become green again, so they will open, or the midwife village and the cadre will be do sweeping, do the immunization, but sweeping, not all only the targeted. Okay, this time for the measles, okay, the target and who, and next week they will do the sweeping again for another immunization, the kind of the immunization. So this is share from me, from Labuan, Indonesia. Uh, Only that. Thank you. Maybe any question or something else?
All right, thank you very much, Eunice. I'd just like to invite you to stand by, and then I'll directly invite Francois Gaz, if he has any questions, to ask you to compliment, for you to tell us more about your story. Francois?
Yeah.
Yes. Thank you, Eunice. It's an interesting story. I think my understanding is that you are a health promoter and you are
Yeah.
focused on an idea to create awareness in the public and convey the right information about COVID and
Yes.
the immunization system. I was, you explained a bit what you do, that you have posts in every, 150 posts to immunize at village level. Some are supposed to come every month. And you are trying to be sure that all the women who need immunization, could be measles 1 month and other disease another month, but you make
Yeah.
sure that they come. Now, you have involved a lot, I understand, you have involved a lot of leaders, but in practical terms, can you detail a little bit? You have collected useful information to guide your practice. Can you explain a little bit more of the special form that you feel with a volunteer that guide your community action promotion after? Can you explain a bit more?
Okay. The form usually is the simple, only the date and the activity. The activity we have four classification. One is the health education. One is the only like a counseling, and the third is about the in the mosque we already do the some announcement in the mosque, and the fourth is about the IEC, because we distribute the IEC. So which one activity they do, they can choose from the four criteria, and after that they can fill male or female. No, no, they can choose in the post. They do in the post or in the community. In the community, maybe can be in the mosque, maybe can be in the housing or other places,
And this is done
or
by
they
your,
do in the
so,
post.
sorry,
Yes.
this is done by your community worker. Who is doing
Yeah.
that
Yeah.
ISC and those different topics?
Community
Who is
worker.
doing that?
Sorry.
Eunice was asking who is doing that. Is it the community worker? Who exactly is doing that?
Doing that. Fill it from the community work.
Sorry, I
The
can't hear.
cadre will fill
Hi, Eunice. Unfortunately, we can barely hear you. The line is breaking. Sure. And meanwhile, there are some very interesting questions that we have here on the chat. Can you try again? So Francois was asking, who does the work? Is it the community worker?
Yes, community worker.
All right, that's great. Okay, so there is a question here. There are some two questions on the chat. There is a Ponyak Victor Bako that asks, what about women who refuse to bring their babies for Penta-3 vaccine? So
Yes, usually they will. Yeah, they will coordination with the health worker, community worker. So they inform the midwife in the village if the stock they have in the uh, health center, they will bring when they are sweeping, because not so many baby or children will need the same vaccine. So usually they will inform the midwife village to prepare it. So when they do the sweeping, they will come to the house and give the immunization.
okay, so how do they get to convince the mother when they come to the house to accept that her child should receive the vaccine?
Mm-hmm. They will go there with the motorcycle together. The cadre will be awaiting in the house of the child, and the midwife will come with the motorcycle, bring the vaccine or immunization, and do the shot in the house.
All right, I see Sohini Sanyal has one last question. Say, Eunice, do you train the health workers who then conduct the pearl sessions, or do you contact the sessions yourself? If the health workers are the ones conducting the final pearl session, then how do you ensure that the knowledge you shared and the quality of knowledge is being maintained in the pearl sessions? Do you monitor these sessions too? So I think you have already answered the previous question. The last question maybe is, do you monitor these sessions?
Yes, we will monitor the session because we give the train to them. The started, we just give the basic information like why we must use the mask, why we must clean or hand wash every very often, and why we must have a space 2 meter. The first, we give the train about it first, and after another meeting we share the experience, and if they have question they can do, we build the WhatsApp group for each village. So if they cannot answer, they can ask directly in the WhatsApp group, and the other cadres or the other community worker can see the answer so they know if they have a same question, they already know the answer.
Okay, and there is the final question that I'm going to read now. Say, how do you plan to catch up in the red zone areas?
In the red zone area, we come and we still do the meeting, but very fast, maybe only 30 minutes. We already discussed in the group what topic we want to discuss before the meeting. We already planned. We already asked them what they want, what they still confused, or what the information they want. So when we come, we just give it, or we can give by WhatsApp group. If we cannot come, we just give it by WhatsApp group.
All right,
So
thank
the
you very much.
information can, the session can be start, but in the WhatsApp group.
Okay, thank you very much. And I see Sohini Sanyal is satisfied with your answer because he says, okay, great, thanks, Eunice. WhatsApp is a great tool indeed to help provide more support after training health workers. So Francois, a final word concerning Eunice's idea, and then maybe we can turn to Atai Abubakar for him to share one last idea before we separate today.
Thank you, Charlotte. I just wanted to know, in the context of those villages, you have a large number of cadres. How many cadres, how many families are served by your cadres? Is it a huge amount of work, or is it a very reasonable amount of work? If it's 10, 100 families, how many a cadre looked after?
One post have 5 cadre because the cadre is already established. We not make the new one. We use the what we have before the pandemic. One post have 5 cadres, and 5 cadres will be conduct for one village, and it will be help from the public figure there, like ulama. They will help to the cadre, and many volunteer from the teenage. The school are closed, so they will help the cadres. The volunteer will be help for hand wash tools, because they put hand wash tools in the village, some of the hand wash tool. So the teenage volunteer will be helped to see about the water supply, soap supply. If finished, they will fill it, the water and the soap.
Okay.
Yeah.
All right. Okay, thank you very much, Eunice, for sharing your story with us today. Francois, is that okay?
Yes, it's okay. Thank you, because we have a nice experience of the community, so the frontline workers, and the importance of having, you need quite a lot of people to address all the needs of the community, reassure them. You have put in place a system, and you have a system to train your health worker, your volunteers, to meet the needs of the community and reassure them. So that, I'm sure, it will be very useful to maintain and restore your musician program. I wish you good luck.
Okay, so thank you, Francois. I'm sure Eunice has received a lot. And Eunice, you may want to read all the comments that have been written on the chat in reaction to your presentation. So right now, I'm going to invite Atai Abubakar. He was the second person to raise his hand. So Atai, if you're hearing me, can you just unmute yourself and share your story with us? Okay, over to you.
Yeah, good evening, good morning, good night, depending on where you are. Let me borrow from Alan's.
Oh, sorry, Atai. It's Eunice, please, can you mute your microphone, please? All right. Thank you, Atai. Go ahead.
Yeah, good evening, good afternoon. My idea is based on experience that just happened of recent, and it happens in Nigeria, in Zamfara State. We lost a health worker due to COVID-19. So people from his community, caregivers, are not coming out to attend any services in that facility because they are afraid they may get the virus. So even immunization is affected seriously in that community. So we look at the data, our data for week 29 and week 30, we saw there is high rate of dropout. People are not coming out again. So what we did now was to train our voluntary community mobilizers, religious leaders, and some NGOs so that they can move either house to house in religious gathering and some areas where we can find a lot of caregivers so that they can sensitize the caregivers and the community people. So that's what we did. And it happens at a ward level, that is the lower level of the LGA, which is the Primary Healthcare Service Center. So those are the measures we have taken now. So as of this week, there's a little turnout because I was at the facility yesterday. We have like 6 clients that come for services, 4 for immunization, 1 for antenatal, and 1 for clinical services. So those are briefly what I have to share with you.
Thank you very much, Atai. And I just want to ask you, what was the specific message that you gave to the voluntary community workers and the leaders during the training? What was the message they were supposed to carry back to the caregivers, to the community members that made people to start coming back to the health facilities?
What we told them that COVID-19 is real, but there is way you can prevent yourself from getting COVID-19. You can use face mask. You can wash your hands with water and detergent. You can use hand sanitizer. You can observe physical distance. Avoid crowded area. If you want to cough, you turn your hand and cough in your elbow. So those are the key messages we gave them, and we show them when the facility is being disinfected. So everybody has seen that. Those are the messages passed to them.
What about messages concerning immunization?
Everything was passed during the training. Okay. Immunization is very essential during this period. So there is need for you to come out and continue with your immunization. Coming to the health facility because the healthcare worker died in that facility does not mean you are going to be infected, because he was away for a month. So the incubation period happens even maybe when he left the facility. So those are the messages we try to pass during the training.
All right, thank you very much, Atai Abubakar. And just to say, you took part in the pilot phase of the COVID-19.
Yes. Hello? Hello?
Hello?
Hello?
Hello? Maybe,
yeah, Francois, I can hear you.
Yeah.
Sorry, I missed your, my network is fluctuating.
All right, I'm so sorry for that. So I'll just directly ask, I was just congratulating you for all the ideas you're sharing on the ideas engine. And then just to invite Francois to comment on your experience shared and ask additional questions if that is necessary.
Thank you, Charlotte, and thank you for presenting your experience in Nigeria. One thing, you know, it was very clear. It's very sad, and you know, I think in all countries, we've seen many as medical workers, you know, victim through their work of the COVID, and it's very sad. And this is directly linked to my questions: is that now what's being done at the health facility to make sure that no medical workers will be victim, because you imagine the consequence even for the communities with all what you said. If one new health worker die from COVID, you lose credibility. So can you reassure me on what do you have all those preventive measures that you talked about? Are all the protective equipment available for the health worker? That's my first
Yeah,
question.
for the health worker, Francois, we have provided all the necessary PPE for that level.
Yeah.
We make sure that any person coming in for services, we must do triage to make sure he has no history or contact with any person with history of COVID.
Okay.
Then, secondly, there is enough hand gloves in that facility. Anybody coming must wash his hand with soap and running water, while it's a vertical bucket at the entrance of the facility. You are not to touch even the tap. Somebody will open it for you, you wash your hand and it will close. Then we make sure that you do your hand gloves immediately after finishing, you remove the hand glove and dispose it accordingly.
This is very good. One thing, the last question, you mentioned you were visiting the health facility and there were 6 clients to the health facility. But
yes.
was this figure was low or high?
Was low.
Or is it a better figure, or is it a baseline figure from which you're going to see if there is any improvement or not?
Yeah, there's improvement, Francois, because for the past 2 weeks, we recorded 0 client flow.
Good.
0.
Glad to hear. But what's your dream? What number is your dream? Is you move from 0 to 6?
Yes, we moved from 0 to 6.
Compared to pre-COVID, do you expect 0 to 20 or 0 to 50?
Pre-COVID, we can get more than 20, 50, 60.
Before COVID?
Yeah, before COVID.
Okay, so it's a step towards, it's a progressive, it's a good step forward. And I hope that all your activities will lead to soon reach the number of clients that you had before COVID. So I wish you the best.
We hope so. Thank you, Francois.
All right, so thank you very much, Atai Abubakar. And there was one question from the Q&A from Arif Amadullah that says, sorry for the late participation in the program. How can I get these slides for my further use and information? So there is a resource folder for the course, but we could share the slide deck on the Telegram platform after this. Essentially, these are not, they are just a few slides, basically the questions on how to share your ideas, and these are drawn from the ideas engine itself. So these are the same questions you will see on the ideas engine when you want to share your idea. And we are 3 minutes past the 30-minute mark that was set for this session, but I think we have had 2 very helpful and constructive ideas during this session, targeting the same challenge, which has to do with caregiver hesitancy to attend health facilities due to fear of contracting COVID-19. And it has to do with how to communicate better so that the caregivers can attend these services. So I would just like to, I'm not seeing any other comments on the chat, mainly greetings. And so for the 2 raised hands that we have, I'd just like to invite you to be there tomorrow for our session at 6 p.m. Geneva time. And we would be glad to ask you to share your own ideas. So before we go today, I just want to ask Shalini, who has listened to 2 very interesting ideas, one from Indonesia, the other from Nigeria, what she was able to get and what she can say to the scholars in the room concerning how they can better build their ideas. And we also have, and then we are going to conclude with Francois Gaz, who is going to give maybe concluding advice to scholars that are going to still have to share their ideas in the ideas engine. Over to you, Shalini.
Hi, Charlotte. I think it was absolutely fascinating to hear the scholars talk about their ideas and what they've been doing. But I would say that it would be more useful if we give the floor to Francois, to guide them. And it would be great if we could hear him guide them.
Thank you, Shalini.
Yeah, because we're running out of time, and I think
no. What I think my comment would be for the listeners that are going to share ideas and put ideas in the idea engine. I think it's important to have enough detail and to follow the steps and the information required for you to describe your idea. To be very specific when you describe the problem, it could be a dropout, it could be, we have seen no attendance to, it's very important, the stop of attendance due to one health worker, unfortunately and sadly dying from doing his work. And I think it's very important to have a very specific problem. You need to be very clear on the idea that you have chosen to overcome this challenge. And very important, how did you do step by step to do that? What was the step 1, step 2, step 3 to get your idea happen? And share with us if you have a beginning of the results, you know, like in Nigeria, then you were from 0, you went to 6, but your objective is 50, for example. I think it's important to monitor if what you do will have an impact and share, because people will learn from that a lot. So good luck, and I want to see a lot of good ideas, as you have seen today, totally described that everybody can understand and maybe use in their own context. Thank you.
the only
Thank
thing,
you.
Charlotte, I would like to say is when anyone is approaching the ideas, what they could think of, and as François said very well, that you have to go step by step. And always, if you keep these 4 or 5 questions in your mind, who, what, where, when, how, and you start defining one by one each of these steps, so you will come to a conclusion. And as you do in public health, you know, you should think of the inputs, the outputs, and the outcome, and what the impact would be. So it'll clarify a lot of things. And do ask questions to yourself whether you have defined everything. And if anyone is reading through your idea and wants to adopt it, they have enough material or resources to replicate the idea. And it should be measurable so that, you know, it is meaningful for your country's context. So thank you, Charlotte.
All right. Thank you very much, Francois. Thank you very much, Shalini. And just to say, if you have any question, any challenge that you're facing with using the platform or even the ideas engine, there is this form that you can just fill. It's the share with the scholar team, and we will be glad to respond to you and to answer to your question. That said, I see a question on the chat from John Thompson, who says he wants to know how to connect to Skype. And if you want to know, I would like to invite you, John Thompson, to join Alain Blaise tomorrow at 11 a.m. Geneva time for the technical support session. And during that session, you will get directives on how you can join your country Skype group. Thank you to Obed Philip Nyobe from Ghana for joining this session, and thank you to everyone. But I want to most especially thank Eunice and Atai Abubakar for sharing their experiences with us today. And there is Ite Ola Oye that says, please, is sharing an idea compulsory? We don't want to say compulsory, but it is a requirement. It's a certification requirement for the COVID, the peer hub exercise 1. It's a Olayo, you need to submit an idea in the ideas engine so that by the end of the day, you will be able to clearly show an action. And you're not only doing it for yourself, you're also doing it for your peers that have joined the peer hub. So please make an effort, submit an idea in the ideas engine. Sorry, we can't take any more raised hands today. We have run out of time, and forgive us for going 10 minutes ahead of the reglementary 30 minutes that are meant for these sessions, but I hope that it has been useful and fruitful. And I can only say, let's make it a date tomorrow at 6 p.m. Geneva time for our next session. And until then, I can just say, keep the ideas coming in the ideas engine, keep the ideas coming. And who knows, tomorrow it will be your idea that we'll be hearing, and your idea could change the immunization performance in a country. tomorrow. So thank you very much. Stay safe and stay fine. So until tomorrow evening, it's bye from me, from Francois, and from Shalini, and the rest of the scholar team. Bye for now.
Bye.
Bye.
Mm.